You're going to start hearing more and more about that. But let's get to our health topic today, because I want to talk about tendinitis. Tendinitis refers to inflammation or irritation of a tendon, the band of tissue connecting muscle to bone. In reality, many tendon problems are part of a broader degeneration rather than purely just acute inflammation. So here are some general causes and risk factors for tendinitis. Of course, the big one is overuse, right? Or repetition. Repeating the same movement over and over can put stress on a tendon and lead to tendinitis. So sports movement or occupational movement. Of course, injury can cause tendinitis with increased load, and tendon degeneration, right? So tendon degeneration comes from deficiency, nutrient deficiency, right? Things like collagen can help with that. Biomechanical, anatomic issues, so poor form or muscle imbalance, tight or weak muscles. So, it's the body is so, it's so systemic. Like a lot of people think, it's the point where you're feeling the pain where the problem is. But a lot of time with tendinitis, it's because where the pain shows up is because something further down the line or up the line has actually been injured, and you're causing overuse because that tendon is now overcompensating. And we don't think of it that way. We think of what's injured is from the point of origin where the pain is coming from. So it's just kind of a different way. Underlying medical conditions that can cause things like tendinitis: diabetes, rheumatoid arthritis, gout, thyroid disorders. Obesity can relate to tendinitis because of increased load and in being in an inflammatory state. Because if you're carrying extra weight, you have inflammation. You have inflammation when you're carrying extra weight. Poor vascular supply. This is a big one that people underestimate. So some tendons have naturally poor blood supply. And then if you have poor vascular supply to those tendons, it impacts it even more, making healing slower. And also it puts you at risk for micro damage to those tendons. There are medications and drug-related causes to tendinitis. There are specific medications known to increase the risk of tendon problems. So beta blockers, blood pressure medication. The strongest evidence is for other drug classes, beta blockers, BP meds can indirectly cause tendinitis. Let's get to the rest here. So the strongly implicated medications are things like antibiotics, corticosteroids, statins. Certain breast cancer therapies cause tendinitis. What else? Blood pressure medication, beta blockers, calcium channel blockers. These are all associated with tendon problems, especially in the feet. So there's a 2023 article noted that patients with Achilles tendinitis rupture often have a history of drugs like beta blockers or calcium channel blockers. And there's another study that hypertensive patients on calcium channel blockers experienced tendinitis as well. Older adults taking blood pressure and cholesterol lowering medication are at risk for tendon inflammation and tendon ruptures. There was an article in Pharmacy Times that commented noting that beta blockers can interfere with the breakdown of defective cell components, triggering immune-mediated inflammatory reaction. Blood pressure meds can be implicated. The evidence is sporadic. So there's some on one side of it, some on the other side of it, which is very common, especially when you have drug companies funding studies. So it's reasonable to have a discussion, to ask about it. Medications with the strongest evidence, again, injected steroids are a big thing, statins. What else did I want to mention about this? Long-term steroid use and long-term statins are something to definitely consider if you're having tendon issues. Putting it all together. So repetitive motion, overuse of tendon, but largely that is due to a biomechanical situation. So we're not taught how to be cognizant of our movements often. So we'll slouch, we don't even realize we're slouching. Why are we slouching? Poor core muscles, right? But we tend to then blame that on the tendon instead of there is no spot healing. There's no like spot. Just like you don't lose weight in a spot. We wish we could, especially people that have like abdominal fat or whatever. It's like, oh, I just need to lose this belly and then I'd be skinny. We don't lose fat in a spot. We don't heal things in a spot. We are synergistic, systemic beings, right? You have to bring the whole thing together. You don't cut out inflammation from the body. Your whole body's creating inflammation. So you have to dial back the assaults on the body that are creating inflammation. So there's no such thing as like spot healing, And the same thing, like this doesn't, with overuse, it's not because of just, the compartmentalization. It's because your body mechanics, you're not using your whole body to do that repetitive action. So you have to learn how to engage all your muscles when you're doing things. And, so like my daughter was dealing with something with her knee last year, which she's never had any knee problems, but come to find out she wasn't really firing her glutes when she was doing this particular movement. And without firing the glutes, all the pressure was getting put on the knee. So of course it's going to start to act up because that's where the burden is. You're putting too much burden. Once she started firing her glutes doing this movement, of course, we did some red light therapy. We took some turmeric for inflammation, some cellular reset. We dumped a whole bunch of anti-inflammatory nutrients into her. Boom. And now when she's doing that movement, she thinks about her glutes, right? And so that's really helped her. She doesn't even have the problem anymore. It's gone. So think about what you might not be engaging in that area, right? What else? Inadequate nutrition. So are you getting the nutrition that you need to feed? So collagen comes to mind with this. It is such an important part of nutrition. We do start to lose it after the age of 25, and all your fascia in your body needs that collagen to remain pliable. And when you don't have collagen, it becomes less pliable, the fascia. And when the fascia is stiffer, it's not able to move, then you're setting yourself up for injury. And it's like, oh, well, when I fell down when I was little, when you fall down when you're little or you watch a baby fall, it's almost like they bounce, right? They get back up, a few tears or whatever, but they're fine. We fall down when we're older and we're like, oh my gosh, we're almost terrified of it because we feel like we'll probably break every bone in our body. That's because of lack of collagen. We need that collagen to kind of soften the fascia and keep it hydrated. Super, super important. Yeah, we could probably talk about this a little bit more tomorrow because I have a lot more to cover, but that'll get us started. Thanks so much for joining me today, everybody. This has been Naturally Inspired Radio. I'm Tammy Cuthbert Garcia. I'm so glad you joined me. We'll be back tomorrow right here at 3 o'clock.